entitled Risk Factors of PTSD, Depression and Anxiety in Patients with Previous COVID-19 Infection, a systematic review and meta-analysis, presented by Mrs. Ira Maria Mison Aquino.
Good afternoon, everyone. I am Ira Maria Aquino, and on behalf of my co-researchers from the University of the East Ramon Magsaysay Memorial Medical Center, I am here to present our paper entitled The Risk Factors for PTSD, Depression, and Anxiety in Patients with Previous COVID-19 Infection, a systematic review and meta-analysis. The COVID-19 outbreak has claimed millions of lives worldwide and continues to affect our economy and healthcare system. The effects of COVID-19 can last beyond the present infection and has been indicated in the development of neuropsychiatric disorders such as depression, PTSD, and anxiety. While there are numerous studies on mental health among healthy populations during the pandemic, data on mental health outcomes of COVID-19 survivors are limited. Due to the increasing number of psychiatric cases reported during the pandemic, this meta-analysis will be a valid evidence-based guide for physicians that can help in predicting onset of psychiatric disorders and providing appropriate management. The main objective of the study is to determine the risk factors associated with PTSD, depression, and anxiety in patients with previous COVID-19 infection. Now, as for the methodology, the study was done according to the guidelines set in the Chakri Handbook for Systematic Reviews for Prognosis Studies and the PRISMA Checklist. The eligibility criteria includes cohort and cross-sectional studies reported in English from 2019 to October 2021. The studies must have participants with previously confirmed COVID-19 infection, were screened for PTSD, anxiety, or depression, and identified risk factors associated with the aforementioned psychiatric outcomes. Mesh terms were used in searching through the following databases. The risk of bias was assessed using the Newcastle-Ottawa scale for cohort and cross-sectional studies, as it covers incomplete outcome data, dropouts, and selective outcome reporting. Now, results were synthesized using Reference 5.4. Initial search yielded a total of 515 articles. A total of 8 studies were included in this meta-analysis after screening for duplicates and appraising full-text articles. Now, both cohort and cross-sectional studies were considered low risk according to the criteria set. And these were the following risk factors that we assessed. Now, 3 studies showed a positive association between female sex and depression. Females were 1.47 times more likely to have depression, while 2 studies showed that patients with family members also infected with COVID-19 were 1.56 times more likely to have depression than with patients who don't have infected family members. Now, mechanical ventilation and steroid administration were found to be positively associated with depression, but were not statistically significant, while non-psychiatric comorbidities and ICU admission had negative association with depression. Now, we have one study here where patients that were administered with steroids had 1.20 times more likely to have anxiety, while female sex and ICU admission had a positive association but were not statistically significant. Now, it was also found that female patients were 2.13 times more likely to develop PTSD, while educational status, marital status, steroid administration, mechanical ventilation, and family members with COVID-19 either had negative association with PTSD or not statistically significant. Now, let's move on to the summary of evidence. A total of 8 studies have been used in identifying risk factors with a total population of 1,438 participants. Female sex as a risk factor supports majority of the studies showing females suffering more psychiatric symptoms after COVID-19 infection. This may be caused by an infection-triggered disturbance in the immune system that increases NF-kappa B inhibitor expression in females, which can lead to the development of depression. Gender roles may also play a role in this. Then having one or more family members infected with COVID-19 also triggers the perception of guilt, where the patient may feel guilty since they think they may have been a possible source of infection and are also concerned for the health of their relatives. Since back then, severe COVID-19 infections may lead to death. Knowledge of this possibility can trigger onset of depression also. There's also been association between corticosteroid administration and higher mortality in critically ill patients, and that high doses can induce psychosis. Activation of the HPA axis by high levels of steroids can lead to the decreased serotonin and increased dopaminergic activity, resulting in psychotic, mood, or anxiety disorders. While certain drug reactions, such as that with fluvoxamine, can also increase the risk for induced psychosis. Other risk factors identified were negatively associated with predicting depression, anxiety, and/or PTSD, or were statistically insignificant. Well, now, with this in mind, this study can impact management of patients with previous COVID-19 infections, as physicians become aware of risk factors that can lead to the development of psychiatric disorder. This allows for further individualization of each patient's therapeutic plan through inclusion of psychotherapeutic techniques that can prevent aggravation of their mental health and improve their overall quality of life. Thank you very much for your kind attention and have a great day.
Thank you very much. Well done. Now, so do we have any questions of our on-site judges?
Okay, thank you for a very nice presentation and informative study. I would like to know from you whether the included study provide the actual number of participants with newly diagnosed disease, or whether they provide you the relative risk, and are those relative risks adjusted in the original study or not?
In the study, sir, that we have gathered, they actually did include the number of participants that were newly diagnosed with depression, and those were the included studies that we added in the meta-analysis, since we didn't include those that had depression before already.
Okay, thank you.
Thank you, sir.
Any more further questions on both online and on-site judges?
You had just only 4 cohorts in your analysis, right?
Yes, ma'am.
I would like to know what is your last TED publication that you include in your study? I mean, I just wonder why it's quite small number of sample size for the study that include in your analysis, because I think this issue is quite big issue, and just wondering why just only 4 recruited.
Yes, ma'am. The problem was that there were several studies actually. However, most of those studies had patients that were still infected with COVID-19. Therefore, they weren't added to the meta-analysis.
Thank you so much. Are there any more questions from our judges or any suggestions?
What about the quality of those studies? Is it all good quality, right? Did you?
Yes, sir. Since we were able to get these studies from Sino, EBSCO, and PubMed, etc.
Okay, wonderful. Thank you.
Thank you so much. Are there any more additional questions, comments from our judges in both on-site or online?
Were the criteria used for diagnose depression and anxiety similar among the included study?
Yes, ma'am. We used validated questionnaires from both the cohort and cross-sectional studies.
Thank you.
Thank you.
Thank you. Do our judges have any comments or any questions? Thank you so much.